Hello, my name is Jessica Kaufman and I am a student RN.
Hello, my name is Abdul Kenny, and I'm a student RN as well.
So we're going to go into the following scenario and Abdul's going to open up.
All right, we have a scenario here that we have to do. This is the scenario. Mr. O is a 63-year-old. He was dizzy and lightheaded at home and almost fell. His wife brought him by car to the ER. Mr. O was admitted to the AMU with syncope. This is not his first time being admitted to hospital. He was treated in the past for congestive heart failure and acute myocardial infarction. He feels like he's pretty healthy and he's only taking NSAIDs at home for chronic back pain. Mr. O got to the AMU at 1600. His nurse Jeremy, RN, assessed him and found his blood pressure 138/84 and pulse of 76 and regular. And his respiratory rate was 16. His alpha bile at 98.6. Mr. O labs were normal, but his IV infiltrated during transport. Jeremy RN started a new IV and put a warm compress in the whole site. Jeremy RN reported off to Ben RN at 1900. At 21:30, PCA found Ben RN and told him that he had just helped Mr. O off the bedpan. Mr. O had a large black terry stool and complaining of not feeling well. Ben RN went in to assess Mr. O. His vital signs were blood pressure 94/66, pulse 114, and respiratory rate of 24. His pulse oximeter was 97%. He was pale and his skin was clammy. Ben RN asked him how he was feeling. Mr. O said he just didn't feel well and could not get comfortable. He asked if he could have something for his belly. It's really hurting, he said. Ben RN assessed his abdomen and found it is distended and Mr. O had diffuse abdominal pain. He rated his pain as a 6 on a scale of 1 to 10. That's our scenario.
So prior to calling the physician, we followed these steps. We assessed the patient for calling. We discussed amongst ourselves. We also reviewed the chart for the appropriate physician to call. We also read the most recent physician progress notes. And he was admitted at 4/21/19 for syncope. And so we're going to go into the situation. And so in Unit 2, hello, my name is Jessica Kaufman, RN. In Unit 2, calling in regard to Mr. O, room number 263. The situation is in regard to a 63-year-old male patient admitted to the AMU with syncope yesterday at 1600. He has a history of congenital heart failure and acute myocardial infarction. He takes NSAIDs for his chronic back pain. His vitals were all within normal limits, with prehypertension of 138/84. His IV infiltrated during transport. RN Jenny started a new IV and placed a warm compress on the old site. At 1900, she reported to RN Ben. At 21:30, the PCA assisting Mr. O to the bedpan reported to Ben that he saw large black terry stool, with patient reporting he did not feel well. Vital signs were immediately assessed and findings were reported as follows: respiratory rate of 24, pulse of 114, blood pressure of 94/66, and pulse ox of 97%. Skin assessment findings were shown to be pale and clammy, and subjective reports were as follows: Mr. O said he didn't feel well and he could not get comfortable. Patient requested pain relief for his stomach, stating it's really hurting. Abdominal assessment showed distension with diffuse abdominal pain Patient reported pain out of 6 on a scale of 1 to 10. The patient is experiencing GI bleeding related to upper GI tract bleed. The lining around his stomach has ruptured, most likely due to his NSAID consumption. No recourse of when the bleed started, for how long, or for how long Mr. O has consumed the NSAIDs, and what amounts daily or routinely. The GI bleed is severe based on systolic blood pressure drop of low 90s at 94 from 134, with elevated pulse and respiratory rate compensation. Immediate intervention is required.
Okay. And now this is our background. Mr. O was admitted for syncope on 4/21/2019 at 1600 to the AMU. As for histories of medication, there's no known history of medication besides what Mr. O stated. He said he takes NSAIDs at home for his chronic back pain. Labs have been completed, but we're still awaiting results. His most recent vital signs again are blood pressure 94/66, pulse 114 beats per minute, and respiratory rate is 24. And oxygen is at 97 percentile. And he again stated a pain of 6 on a scale of 1 to 10. He also overall have a history of congestive heart failures and acute myocardial infarction and chronic back pain.
And now for the assessment. Upon the assessment, we found that the patient's skin is pale with diaphoresis. Patient abdominal shows distension with complaints of pain throughout all 4 quadrants of the stomach. Patient's stool is black and tarry, indicative of GI bleeding. And patient appears to be in discomfort and pain.
Okay. And as for the recommendations, we recommend a GI consult to see Mr. O, and also to put in some orders. We recommend to place Mr. O immediately on NPO until he's seen by a GI consult. We also recommend to start Mr. O on 0.9% nasal saline at 125 milliliter an hour, and also to observe Mr. O's oxygen levels, and if it drops below 92 percentile, to put on 2 liters of nasal cannula. We also recommend to order hematocrit, and hemoglobin, and also order CT and ECG scans. And more orders would be for troponin, CKMB, electrolyte, and other liver function tests. We overall recommend taking Mr. O off NSAIDs and switching to analgesic for pain management. And we also recommend to consult PT to see Mr. O. Also, we think it would be valuable to have orthostatic blood pressure taken on Mr. O.
And so to document the change in the patient's condition and physician notification, the patient came in with vitals within normal limits, and the last set of vitals were as follows: respiratory rate of 24, pulse of 114, blood pressure of 94/66, pulse ox of 97%, and pain rated 6 on a scale of 1 to 10, abdominal distension present with diffuse pain, black tarry stool, and patient complaints of pain, especially throughout the abdominal. So thank you. This concludes our Sbar, and once again, I'm Jessica Kaufman, student nurse.
I'm Abdul Kenny, student nurse as well.
Thank you.
Thank you.